I studied podiatry as a mature student, so I had lots of experience prior to becoming a podiatrist that was relevant to my current job role, really. So I worked in the private sector, worked as an exercise physiologist, and I'd also worked in the fitness industry as well. So the combination of a lot of both those roles basically gave some good prerequisites to becoming a podiatrist. So I graduated 2015 from the University of Huddersfield, and just started as a sort of band 5 pod, covering all aspects of podiatry, from sort of routine care, nail surgery, and a little bit of MSK. And I was lucky enough to take part in a secondment that was advertised about a year and a half after I graduated, which was great, working as a podiatrist with special interest in biomechanics. And that's led to my obviously current role now over the last 5 years, which is good. I really enjoy the service development, but also the development of staff as well. I also do see a lot of student podiatrists also, so trying to get more involved in education of students. So currently we have the year 3 podiatry students coming on board, and I always put my hand up to be part of that as well. So I really think it's important to pass on obviously skills and knowledge that I've learned, but also to help other students who also look like me see that there's people like me doing that role as well. So I think that's really important for the future. Currently, we're doing a lot of things like service development. So for example, we're using digital technology to help patients access us a little bit easier. So for example, we do video consultations and so forth as well. That was something planned before pre-COVID, but has accelerated because of COVID, I guess. So we use that and making sure we can access patients in easier ways for them, and not just the ones that are sort of housebound or anything like that, but for patients who work a lot. A lot of patients find it difficult to get time off work to take appointments, but they can do a 15-minute video consultation or half an hour video consultation on the phone during a break or something like that. So we've been involved in that anyway, and I think it's really important that upcoming AHPs are aware that those type of things are happening, so they're sort of ready to go when they come into practice. In terms of diverse and inclusive leadership, yes, there's plenty of opportunities to get involved in leadership within your role as an AHP, but also within the trust that you work for as well. So, for example, I work as Race Equality Network chair. I'm the chair at the moment at Leeds, and it's important being an AHP that obviously AHPs have a voice, because sometimes we're often forgotten, because being a podiatrist, we're one of the smaller AHP professions, and sometimes we're not always heard. So it's really important that we take the bull by the horns, really, and look for opportunities to be involved in leadership as well. The importance of educators and educator roles, it's difficult to put into one sentence. It's vital for the sustainability of our workforce, but also to keep and sustain the workforce that we've got as well. Because I think without piquing people's interests and educating people in different areas of human behavior, not just things like podiatry and so forth as well, is vital for how we stay alive as a profession, really.